Hello, my name is Caitlin Witz. My clinical case study was on cancer and malnutrition. The patient is a 72-year-old male. He was first admitted into the hospital on February 17th. The patient's chief complaint at this time was syncope and collapse and weight loss. Upon admission, the patient weighed 206 pounds with a BMI of 29.73, which is overweight. The patient was newly diagnosed with metastatic prostate cancer. At first admission, he had not begun receiving treatment. At his second admission, he was diagnosed with weakness, dehydration, hypokalemia, and hypocalcemia related to poor nutrition status after his first round of chemotherapy. At first admission, the patient had lost 60 pounds in 3 months and an additional weight loss of 8 pounds at the second admission after his first round of chemotherapy. So the patient had one disease state that was relevant to nutrition aside from his cancer, and this was Bell's palsy. Bell's palsy is a neurologic disorder that is most likely caused by a viral infection, which causes a sudden weakness on one side of the face. Symptoms of this include twitching, weakness, paralysis, drooping of the eyelid, headache, aguesia, impaired speech, and the symptoms that were present in this patient, dysphagia, dysgeusia, and drooping of the mouth. This is relevant since this had a great impact on the patient's PO intake. He was already having trouble because he was sick with the cancer, but having this disorder made things a little bit harder. So it was an obstacle that we had to also overcome. So just a couple labs to point out. The patient had critical labs. His potassium and his calcium both were critically low due to his poor nutrition status, and this had to be corrected through IV fluids. And also of note, the patient had a critically low white blood cell count, and this comes into play later on when the patient received his PEG tube. He had to wait, I think it was about 4 days until he could go get the procedure. He had went once and his labs were not very good, so they had to delay the procedure, which caused a longer time span where he wasn't able to get nutrition. Calculating needs. Calories were based off of BMR, which was about equivalent to 20 calories per kilogram, rounded a little bit. And for practice guidelines, 20 to 25 calories per kilogram is recommended in cancer patients who are not obese or bedridden. And for protein, the protein needs recommended for this patient were 95 grams, which is about 1.1 gram per kilogram of body weight. Practice guidelines suggest a minimum of 1 gram per kilogram of body weight a day, with a target supply of 1.2 to 2 grams per kilogram of body weight per day. So, given the chance to do this again, I would probably increase the patient's protein needs a little bit more. So the PES statements that were used: malnutrition, which was related to his inadequate oral intake, and this was evidenced by the patient consuming less than 75% of his estimated needs for greater than 1 month. He also had a 23% weight loss in this period of time as well, and this makes the patient meet the criteria of severe malnutrition of chronic illness. And nutrition diagnosis B is difficulty or swallowing difficulty, and this is related to the Bell's palsy, xerostomia, and the weakness from his chemotherapy. And this was evidenced by a soft diet while the patient was in the hospital, the weight loss, and the patient requested mostly liquids on his trays. So interventions and goals. These will vary a little from each diagnosis. So at both admissions, one goal was meals and snacks, and for patient to consume greater than 75% of all meals and snacks. Medical food supplements for the patient to consume greater than 50% of mighty shakes and milkshakes with Bena protein. During the first admission, it was the mighty shakes, and we used Ensure Plus for him. And then at the second admission, we did the milkshakes with Bena protein, and we found this to be really helpful. The patient was able to get these down without any problem. We were sending these up twice a day, and this really did help his PO intake. And then on second admission, a intervention was enteral nutrition, and this was for the patient to tolerate 2 feedings without complications. The patient did have a few complications. When he first was receiving the feedings, he had some bloating and some diarrhea, and we had to change him from Isosource to Osmolite. And we also, this wasn't a complication, but once the patient started to feel better, closer to when he was being discharged, we were able to change his feedings from about 6 feedings a day that he was getting to about 3 feedings, because he was able to consume greater than 50% of his needs by mouth. So we were able to get that down a little bit. And then the last intervention, nutrition education. At first admission, the patient was educated on high calorie and high protein foods. But on the second admission, the patient was educated on his home tube feeding regimen. So just for practice guidelines, dietary counseling. The focus of dietary counseling is to improve the intake of food and beverages, and is usually the first step in the nutrition support process. Dietary counseling was performed on this patient, as I said before, at his first admission and prior to his chemotherapy treatments, he received this education. The focus of dietary counseling is to improve the intake of food and beverages. It's not shown to improve the quality of life if dietary counseling is used alone, but those who receive dietary counseling alone gain more weight compared to those who receive, as I said, usual care, which would be without nutrition support. So oral supplements, standard oral nutrition supplements is the least invasive and most common method for nutrition support. These are usually used in patients who are not severely compromised and can maintain oral feedings. So they have to have a functional swallow and a functional gut. And it is shown that oral supplementation has an optimal effect when provided in between meals, and it's beneficial to weight gain and physical function. Benefits for using oral supplements were seen when intake was between 250 and 600 calories for greater than 5 weeks. And it's important just to point out that this helped the patient on the patient's second admission, where he was able to maintain his weight. He didn't have any further weight loss while he was in the hospital, which was great. Enteral nutrition is recommended for malnourished patients where oral feedings are not possible, so they're having problems with swallowing or mastication. Feedings can be done short term through an NG tube or through a gastrostomy or a jejunostomy. And usually a PEG tube is a common method, and this was used in this patient. And this has fewer complications compared to the jejunostomy, such as stomal leak, hemorrhage, infection, and ileus. So parenteral nutrition was not used in this patient, but it's just important to point out that it's used in those whose gut is not functioning properly. Um, it's formulated lipids, carbs, amino acids, vitamins, and minerals that are held in a bag and inserted into the bloodstream. And parenteral nutrition is shown to limit the higher protein synthesis that's associated and the catabolism that's associated with cancer. And it's found to be successful in those who are malnourished and receiving aggressive treatment. So in conclusion, this patient was able to be discharged and go home on his peg feedings. Practice guidelines were followed. I would try to increase his protein if able to do this again, but the patient did receive a lot of counseling. He was receiving supplements and enteral nutrition, which was able to be tailored to his needs and to his tolerance. And at this point, it's just, his nutrition status is really controlled by his reaction to chemotherapy. Right, it was my second to last day, and the patient ended up being readmitted again, which I wasn't able to discuss in my paper because it was, right at the end of my rotation. But he was having further problems with his chemotherapy and, just becoming very weak. So his status is very dependent on this at this point, and I really hope the best for him. He was a great patient, and I really hope that he gets to improve. Thank you for watching this, and have a great day.